Obsessive compulsive disorder. OCD is a severe disabling psychiatric condition that usually arises in the late adolescence or early adulthood. Obsessions are recurrent and persistent thoughts that cause great anxiety, such as preoccupation with germs, preoccupation with order and symmetry, and fear of harming others. Compulsions are repetitive behaviors that the person feels driven to perform in response to obsessions, such as excessive hand washing, excessive checking of locks, or excessive checking that the stove is turned off. OCD patients feel compelled to compulsions in response to obsessions, like checking that the light switch is turned off by switching it on and off several times, which may be time-consuming and cause great distress that interferes with normal functioning of the affected individuals. Non-pharmacological treatment of OCD. The most common psychological treatment of OCD is the cognitive behavioral therapy, which aims to differentiate between logical and unsound thoughts, as well as to change the maladaptive thinking. The most effective cognitive behavioral therapy for OCD is exposure and response prevention. Exposure includes repeated and prolonged confrontation with stimuli that provoke anxiety, while response prevention means refraining from performing compulsive rituals. For example, a patient who fears number 13 because it will bring bad luck would practice writing this number several times without performing any rituals to reduce anxiety. Regarding the pharmacotherapy of OCD, the pathophysiology of OCD has been linked to a disruption in the brain's serotonin system. Therefore, selective serotonin reuptake inhibitors are considered the primary drugs for treating OCD. For example, fluvoxamine, fluoxetine, and sertraline are FDA approved for treatment of OCD.